I'm Melissa Perry, Dean of the College of Public Health at George Mason University, and today we're talking about the conditions for healthcare workers. I'm joined by a member of our faculty, Dr. Debora Goldberg, who's been studying this issue for quite some time. Dr. Goldberg, so glad that you're here.
Thanks, Dean Perry, for inviting me to talk about this important topic.
Thanks so much for joining us. What are the factors that contribute to burnout among healthcare workers?
Well, there are differences based on profession, job responsibilities, and workplace settings. But what we see in general is that demanding work schedules, complex job functions, lack of support, even workplace violence plays a role in burnout and stress among healthcare workers. In clinicians, we also see a high level of administrative burden, lack of autonomy, and moral injuries as contributors to burnout.
And it seems like that administrative burden has been growing and growing all the time. I know that you and your team have been advocating for a holistic approach to addressing burnout among healthcare workers. Can you tell us more about that?
Yes, I really think that a holistic approach is what's needed so that we have efforts at the individual level, at the organizational level, as well as at the system level to address this issue. We also need to change the way we think about burnout and to have a broader sense of what that is. So I've changed the way I'm talking about this issue, and I'm phrasing our solutions in that we need to build solutions that work on the health, safety, and well-being of healthcare workers, because all of those are contributors to employee success, and they're all connected.
That makes a tremendous amount of sense, and it really is easy to overlook all of the factors that would contribute to well-being among healthcare workers in the workplace. I know you've been working on the design of interventions. Can you tell us more about what they are and how are they implemented?
Well, we think that organizations can play a huge role in addressing and supporting the health, safety, and well-being of healthcare workers. And so this, the first thing is to build a supportive work environment so that employees feel safe, physically, psychologically, emotionally. We may also need to look at the redesign of jobs, redesign of work arrangements and schedules. We know that employees want sincere efforts from healthcare managers and leaders to recognize the issues around stress and burnout and to include employees in efforts to address this issue.
Healthcare workers are so instrumental to population health and overall health and well-being for our society. Thank you very, very much for drawing attention and shining a light on the importance of their well-being.
Thank you.